Esther Nachiride, a cancer survivor from Mende sub-county in UWOCASO district, has been living in denial after being diagnosed with cancer.
I thought I would not heal and I was scared of dying and leaving my children behind. What scared me most was when I was told they would remove my buttocks.
Afraid of what her family and friends would say after her diagnosis, Nachiride decided to keep quiet and declined to go to Mulago Hospital, where she had been referred for further treatment.
2017
Tumors were in my buttocks. I did not feel any pain. After thorough checkups, I was told it was cancer but refused to accept.
However, her situation worsened and relatives started isolating her and advised her husband to abandon her.
My husband's family advised him to run away and abandon me for fear that I would infect him.
With the situation now far out of hand, she received some counseling and agreed to undergo treatment and was operated on 3 times until her situation improved. Nachiride is just one patient with this problem. Denise Twine, a breast cancer survivor, also underwent fear of stigma due to lack of information about the disease before finally getting care for her condition.
I was scared, I was confused. I had several other tests done and they came out contradicting what the doctors had done in Mulago. So because of that confusion, I decided not to have treatment. I went back home and I went on with my life.
The 2 women say stigma against cancer patients has led to many cancer deaths that could have been solved through creating awareness among the population.
Most of the time we die of the consequences of cancer diagnosis, especially the stigma, the abandonment, the non-compliance to treatment, non-adherence to treatment, the tortures, and those cause mental health and then depression, and maybe you die of depression, you die of anxiety, and the stigma around it. So before the disease actually kills someone, because even the people, when you move around, the people say, oh, you have cancer, you're dead. So people already declare death before even you die. Even health workers discourage the patients.
This prompted the survivors to start an organization called Uganda Women Cancer Survivors Organization, UWOCASO, with the aim of providing support to cancer patients as well as providing the necessary information about the disease.
When we were treated 22 years ago with my other 4 people, there were no supportive services, we were not counseled. And all that time what we knew that once you have cancer, you're going to die. So when we didn't die, we realized we could still do some good work that will help others and tell the world that cancer actually is treatable and curable because we are cured.
They are calling on the government to increase efforts in creating awareness as well as improving cancer treatment services to health facilities upcountry.
They have treatment in the center in Kampala, so people travel long distances to come and they receive the comprehensive care services. So that is still a challenge, transport, accommodation. So
Chancellor Ministry y'ebyobulamu okusookera ddala.
My appeal to the government and Ministry of Health is for increased intervention, as was the case in the fight against HIV/AIDS. My cancer patients are stuck in the villages without treatment or the necessary information about the disease, and most of them think it is witchcraft.
According to a 2018 study at Mulago Hospital, about 32,617 new cases of cancer were reported, resulting in 21,829 deaths. However, it is also noted that the cancer estimates for Uganda are mainly drawn from Mulago Cancer Registry, which covers a paltry 8% of the total population. So, it is hard to determine how many people are sitting out there afraid of reporting their condition to hospitals for fear of overbearing costs of care as well as stigma associated with cancer.